Hello. Hi, Balaji. How are you today?
I'm doing well. How are you?
I'm doing fine. Thank you for being willing for me to introduce you to Jake and to Kim just in case, but we're doing fine here.
Good, good. I'm glad.
So thanks for joining us. You know, one thing that I have started to incorporate is a land acknowledgement. Do you do that in Canada at all?
We do. It happens in, definitely in like large gatherings, like events and things like that. And it is, I feel it is important. Obviously, it takes a different connotation when everything is virtual, because we are all on different land at that point. But I think the sentiment is definitely valued.
Okay, awesome. Yeah, we incorporate the idea that we're virtual into the thing, but it'll just take a minute. I'll do a short introduction, and then really, because we only have 30 minutes, I like to give most of the time to you. Do you have any kind of interesting updates at all? How are things going for you?
Things are going good. Just really busy. Lots going on. I mean, February and probably March are probably be our two best months ever. So we've had a lot of stuff kind of trucking along, and lots of general busyness. So I'm going to focus this on, just explaining the problem we solve and what we do and how digital health companies use us at a really high level. Does that sound okay to you?
Perfect for us. And, really, because we have such a varied audience, my real thought is that you'll help spark entrepreneurs who are gathering with us. I just love the fact that you're solving such a unique problem that I don't think a lot of people, including digital health entrepreneurs, think about. So that's kind of, and then you never know. We have some really interesting people who join us who hopefully will have some good questions. We have an entrepreneur in our community called Kai Holland, and he's a tech visionary kind of guy, and he always has some really, he throws our speakers some interesting questions. So I'm hoping he'll do that today.
That's awesome.
So it's great. And well, I always call these the awkward kind of moments, as we wait for people to kind of gather. I don't know how you have, one group I work with does pirate jokes, but I don't know how you guys manage that, but.
I have to think about pirate jokes.
Welcome, everyone. As you know, I think we'll get more people here at 1 or, just after 1. While we're gathering, everyone is welcome to put their information in the chat. And you might even want to do it a couple of times. People who join later don't always see it. But, really one of our ultimate goals is to make connections between both our presenter and also the people who join us. So if you are working on a health innovation of some type, or you are just a healthcare person who knows of a problem, please let us know that information. That's what we're here for as well. So welcome, Marcy. I'm going to just maybe call you out specifically because I don't believe we've met. Oh, awesome. From Cook Inlet Tribal Council. Perfect.
Yeah. So I'm in Leanne's on leave this week, and she asked if I'd attend. It looks like Jacqueline Summers. Is that you? Sorry, you sent her the newsletter, and she wanted one. She wanted to attend, but like I said, it's spring break. She's with her daughter. So
okay, awesome. Well, welcome.
Yeah, thank you so much. I appreciate it. I'm just gonna sit and listen and take notes, and because I'm new to this, so.
Of course. Thank you so much for joining us.
Yeah, I'm excited. Thanks for having me.
Have you here. So everyone, it's 1 o'clock here in Anchorage, Alaska. I can see from Balaji's clock that it's closer to 5 where he's at. So I am going to get started. So welcome everyone to Health Tie. This is open innovation. It's where we gather everyone together to talk about healthcare changes and innovation and things that we can do to improve the system. I'm really pleased to introduce Balaji Gopalan, and I'm excited to have him here. It's kind of incredible that he's willing to join us. Last week, he and I were exchanging emails and making connections across the globe. So Balaji's in Toronto. We were talking to somebody in Israel and in Southern California, and that's really the scale of what we can accomplish here. I am going to quickly introduce him and then have him begin his presentation. But before I do that, I'd like to start off with a land acknowledgement. I'd like to say that I'm in Anchorage, Alaska, and I'm on the traditional lands of the Alaska Native people, the Dena'ina. If you're joining us in Alaska, you are also on Alaska Native land. And so we just take a minute to acknowledge that. What we'd like to do is we'd like to say thank you to them for their past, present, and future stewardship of our land. So with that, I'd like to introduce Balaji Gopalan with MedStack. This is really an exciting business that really took an interesting problem and developed a solution around it. So Balaji, welcome to Health Tie, and I'm going to let you get started.
Thank you so much, Jacqueline. Hello, everybody. It's wonderful to see you. Thank you for being here today. And I think there's a number of people here who do very interesting work in different areas in healthcare in the community, and I want to thank you for what you do as well. That's probably a good sort of segue into me talking about what I do every day. So I'm going to put my presentation on the screen here. Hope you guys can see that, and hope you can see it now. Is that all showing up still? All good? Excellent. My name is Balaji Gopalan. I am in Toronto, Canada, a fair ways away from Anchorage, but what I do in my business is work with organizations and people who are trying to change the way that healthcare works to deliver better outcomes using technology specifically. That's kind of the nature of my business. And so I'll explain a little bit about how we see the world of digital health and some of the challenges that we see existing in this space as it scales at a time when it's never been more important. And we have some ideas about some things we can do to maybe make it work a little bit smoother, which I'll talk about today. So the first thing probably is like, where did the digital health revolution kind of come from? And I think for a lot of people on this call, this information will be well known. But we spend a lot of money on healthcare, and one of the reasons that things have become so complicated is because the nature of healthcare itself has been driven by complicated healthcare situations. So primarily chronic conditions, where whatever those conditions are medically, they're characterized by the relationships with patients being longer as opposed to just a single transaction. Maybe there's a lot of more different kinds of people involved in care, especially if you start to consider long-term care workers and families and things like that. And there's a lot more data involved in the care. Which is actually an interesting statistic on its own, which I'll share in a moment. All of this has made healthcare very complicated and has resulted in what we see as a capacity crunch. And because I'm in Canada, that's true not only in the US, but it's actually true here as well. We operate in a society with a public healthcare system, but it has its challenges in capacity as well, which we really see by way of like wait times. And of course, a spend on healthcare, even if that spend is through the government, which then flows through down to the people. And so all of this leads us to this place where we really need to think about scaling digital health. And of course, there's been lots of efforts to try to bring healthcare into a technology realm by way of digital initiatives, primarily the electronic medical record. But the electronic medical record system, while very important, has resulted in really good documentation, but hasn't really changed sort of the workflow. And so we think about these things from what drives complexity in healthcare, and maybe there's a different approach that can actually be taken here. So because there's so much need for revolution, and especially if you look at the healthcare industry relative to, you know, maybe other spaces that are surround us every single day. Like think of how financial services have changed tremendously. There was a time when you could only engage with a financial services organization by going to a bank, standing in line and talking to a teller and signing a piece of paper. And now, of course, we know that transactions have become digital, and even currency has become digital. Well, the same kinds of challenges exist in healthcare, but I would argue, and I think we'd all agree, that they're far more critical even to making society work. So there's this now lion's share movement towards digital health. Every time I look at the size of the market, I get a different number. So now we've got this $1.3 trillion number, which grew like 30% in just this 1 year. Why? Telemedicine is now the fastest growing software category in all of software. Because while we've moved to a world where we can interact with each other very, very differently than we could 3 years ago, the needs of healthcare are not stopping. And so those building healthcare have actually seen a lot of attention turning to them. Venture deals, so investments into early healthcare tech companies, are at the highest levels they've ever been in an industry where a lot of other technology innovation and the ecosystem was actually slowing down a little bit. And this idea that the amount of data in digital health has gone up by 1,400% in a few years, I think is a really interesting statistic. By my count, there's about 40,000 small digital health vendor companies in the market today. And then that number is going up every single year. So there's a lot of really kind of interesting statistics on this. Very great news. So whether we're talking about solutions for patient engagement or, virtual care delivery, or using artificial intelligence for insights on delivering better healthcare and making decisions, or even making the work of healthcare workers itself work better, whether you're talking about billing or asset management, tracking public health, measuring the efficiency of our healthcare system, allowing patients to take control over their own health. There's lots of opportunity. And we work with a bunch of them. So my company services those companies, people who are building digital health innovations. And this is a sample of the companies that we work with in all of these different spaces, all doing something really different, often bringing the bleeding edge of technology and other industries into the healthcare realm, and all usually very mission driven by personal stories to make healthcare work better. But there's a challenge. The challenge is around data. Health data is the most sensitive data in the world. A health record is worth 35 times that of a credit card on the black market. Why? Because with somebody's health information, you can access lots of different parts of their lives. And so the healthcare industry itself is governed by both stringent regulations around how they manage information about a person, whether that information is biological information, appointments, prescriptions, engagements with the healthcare industry, personal identifiable information. They're governed by these rules, but also I would go further and say they're governed by public perception. We have to have trust in our institutions, and it's really, really important we have trust in healthcare to make sure that they're taking care of very sensitive things about us in a matter of care. The oath that physicians take when they get their licenses was actually amended in the 1960s to add the line privacy in there. And so therefore these institutions, hospitals and insurance companies and health networks and public health organizations and clinic networks then have an expectation that the vendors they work with who are touching that data, maybe even creating that data, are treating it with the same standard of care, because it's on them, it's on the institutions to make sure the patients are protected. So these regulations apply to the industry, which then apply to everybody that they work with. And if you're one of those people who's building a digital health solution, you're going to be asked a lot of questions around how you're handling compliance. And that's hard. So a scenario is I've got a digital health app, I'm a startup and I'm selling to a hospital, and the innovation lead at the hospital says, I'm very excited, Balaji, about what you're working on. It's going to help the lives of our patients. It's going to help us deliver on care outcomes. But I'm not allowed to buy your solution until you make my head of privacy and my head of security both happy. So how does that happen? Well, there's a few different ways. One is they might just go, show me your security and privacy policies. You surely have a bunch of rules that you follow as a company and that are professionally written and follow all these standards, right? And I'm asking this question of a 4-person startup, you know, or here's our big long 300 question questionnaire around all of your data security and privacy practices. Please answer it. And you have to answer it in the way we need you to answer it, or else we can't work with you. Or I can't even talk to you unless you're like SOC 2 or high trust or ISO certified, for example. And this is what we kind of see happening in the industry. And this has created this dissonance between the creators of innovation and the buyers of innovation that almost nobody expected. And it's slowing things down compared to other industries. And the biggest tragedy is you meet a smart software developer or inventor or thought leader or a change maker who says, I had an experience in healthcare, or I worked in healthcare, or I know somebody did and it needs to be better, but I'm not going to bother changing the way healthcare works because it's too hard. And somebody asked me once, how would I know I've been successful with my company? And I know I'll be successful if I don't hear that again. So that's kind of what we're trying to do. So what we've done is we've taken a look at the world of compliance and said, well, maybe the answer isn't to try to just teach everybody how to do it, because it's a lot of work. It's a role in itself. And we want these innovators to be focused on things that make them all individually different, so they can push the boundaries of innovation further in healthcare. So maybe there's a way to codify this stuff and do it for them. So we've done is we've sort of looked at the laws of regulations around privacy and security and the types of questions the health systems ask, and codified them into a standard set of expectations to really surround these kinds of things. So they usually, if you're talking about digital data in the cloud, and I won't get too technical here, but just show you philosophically how we think about this stuff, it all kind of maps into a few categories, or a stack, which is kind of where the name of my company, MedStack, comes from. The first is this idea of physical safeguards. Is the data, wherever it is physically, we talked about physical residency in the beginning of this call, is that a safe place from the perspective of like, who's got access to the servers, and is there fire protection and security cameras and things like that. So you're going to use a big, well-known cloud vendor who does that stuff for a living and services lots of industries that way. And the second is, okay, that's fine, it's physically safe, but what if it virtually, as it moves around, as the data moves between parts of software, has that been done in a way that's protected? And there's a set of expectations there. And this is the part that's really, really hard. You can't take an app and just stick it on top of Amazon Web Services and say you're done, because all this stuff has to be done in a very specific way, and you can't break it every time you change your app or redeploy or any of these other things. And this is what we saw as the big black box in this industry. And then finally, you need to have governance around this stuff. Okay, you've got your software built, but are your people trained the right way? Do you have, password protection, especially as we're all working at home, around your workstations that might access the data? And so we looked at all the ways this stuff is measured, and that middle box is where we felt the biggest gap was, because it's a black box. Nobody actually knows what's going on in there. So we built a system that completely codifies and delivers ongoing transparent commitments on behalf of digital health companies to cover 2/3 of the HIPAA security rule, basically all of the first 2 boxes out of the box, without people having to build it or manage it or check it. And I'll show you how we do that. So very, very quickly, show you how the product works. We have this answer library, and the answer library we've built over time, going through about 100 of these assessments, probably more, which is a set of questions and the typical responses to those questions. And every time we do another review, our answer library gets smarter. We can even map that answer library to any questionnaire or audit process that comes in and says, this question maps to this answer. And those answers then, through software code, drive the creation of these policies. So we have a whole bunch of policies which are written line by line to map to ISO, SOC 2, HIPAA, Canadian health regulations, GDPR, et cetera. And so you can see where this is going, as these policies then govern these digital health companies. So with that in place, then we give them, the engineers at these companies, the power to say, my app requires this kind of infrastructure. The way I've built my thing requires 4 servers, and they go like this big. And in a similar way that they'd program that on top of a cloud vendor, we're an interface that sits in between. And they say that to us, either through a user interface or through an API that fits their scripting language, if you will. Our system then builds those servers, but adds all of the security protocols as defined by our policies into the software code itself. So they're there. Encryption is done the same way. Backups is done the same way. Audit logging is done the same way for all of our current customers, irrespective of what their digital health app is doing. And then we manage it for them. We manage uptime and monitoring, and we help them manage those things so that they have an infrastructure that's not only compliant, but also operational and delivers on all of the performance guarantees they need to. Finally, as they get an inquiry, which is like, could be a security questionnaire like you see on the left, or it could be an ask of deliver evidence that your software evidence you're doing this stuff, we can deliver that for them because it's all built into our platform and done the same way for all of our customers. We actually have like even natural language processing that reads the question and delivers the answer. So that's what we've done. And we've done this on behalf of our customers for a whole bunch of their customers, which are a number of health organizations of different shapes and sizes in different markets. And this list is growing. We're doing about one of these a week now, maybe two. And so the really cool thing about this is then that makes you wonder, okay, well, how much work is it for these customers, these companies to work with MedStack as opposed to maybe kind of building this stuff on their own? And the answer is, if you're building in a standard kind of technology framework, you don't really have to do anything custom at all. Your app is built to support containers, which is what most backend software developers are doing nowadays. You're using standard, well proven and frequently used database types, and maybe you've got some file storage. That's it. There's nothing new to learn. There's nothing custom to build inside your app. There's nothing specific you need to do. If you do those things, then we interface with those standards to give you the infrastructure you need. And so all of this stuff comes built into our platform itself. I'll talk really quickly just about how we price this, if anybody is interested. I won't go into too much detail on it, but essentially we have this kind of hybrid model, which says we'll charge you a subscription to cover any time you need us to answer any questions. So all of the policies are given to you, all the attestations are given to you, et cetera. And then we tier that based on the level of compliance that you need. If you're operating in Canada and the US, for example, that's requires a little bit more attention from us. So that would be our scale up tier. Otherwise, if you're doing kind of an initial deployment in one region, then the startup tier would be enough. And then you're using infrastructure, but we're configuring it for you. So we're actually paying for the infrastructure. So we pass that through at an hourly calculated cost once a month. Whatever you use, you pay for it just as if you were deploying it yourself on top of, in our case, Microsoft's backend. And then because we're adding security and running it for you, we add 20% to that. That's basically the way we price. But the proof is in the fact that we've helped our customers be successful. That's the part that matters to us most. And so what we do, we're a plumbing company. We do back-end stuff that nobody sees. It's like selling insurance, but our customers do really amazing, bold things in healthcare because they're able to focus on them. These names probably don't mean a lot to you, but I'll just very quickly kind of give you some examples. Skin Check Online is a virtual dermatology clinic. They can actually use imaging to make diagnoses and recommendations around skin conditions. Maple is Canada's biggest telemedicine company. So in our public healthcare system, they actually created an alternative model, allowed you to, set an appointment, talk to a doctor through text or video chat for very common things. And now they've grown quite significantly, especially with COVID, and are working with a number of corporate insurance providers as well. Keratin is a company based in Philadelphia that completely reinvents the process of nurses managing bottles of breast milk for premature babies who are in the neonatal intensive care unit. It's very specific, but it's a very broken process, and they've digitized the entire thing and reduced times that kids are in the hospital, amount of milk that's wasted, and certainly amount of effort and time on behalf of nurses. Trualta is a mental health solution that helps training for delivery of mental health for caregivers. Repisodic is a workflow application for long-term care. And then finally, Amovi, that's just one of my favorite examples. They're a medical device company, and they've created, based on a lot of academic research, a device that non-invasively measures the recovery from knee injury. And they've had a lot of play in the athletics industry, where in fact they were working with folks like the Kansas City Chiefs in training and managing rehab for some of their athletes. we've built this out with a lot of input, both on the startup side as well as on the healthcare side, which we're really proud of. We couldn't be where we are without the partners that we have and have had along the way. And that's us and what we do. I'm happy to take any questions, talk about kind of our journey, talk about where we see digital health going, and some of the things we're seeing every day, or anything else.
So, Balaji, that is amazing. Thank you so much. Everybody just quickly give Balaji a quick round of digital hands. And I'd like to open it up for anybody who would like to ask a question. I'll pause for a minute, and if nobody jumps forward, I'd certainly have a question.
Sure.
Balaji, Jake Carpenter here. Do you handle insurance? I think I am a health app developer, and I currently host on GCP right now. But for any of the stuff we're required to carry insurance. Does that also happen through your platform?
It doesn't. So what we do, but I do have a response to you, Jake. What we do is we essentially govern the architecture of the cloud. In our case, we're running on top of Microsoft's backend, but you can think of it in equivalent to what you guys are doing with GCP, and then deliver all the policies around that architecture. That then allows you a higher sort of security posture to the degree where obviously being in digital health and touching health data, we have to have cyber liability insurance. We've partnered with an insurance broker who's covering our cyber policy. They have offered a special deal to some of our customers. It is unfortunately restricted to Canada right now, but we're expecting to build out more of those kinds of partnerships in the future, because in evaluating a cyber policy for your company, they look at your security architecture, and because we're already certified and can deliver all the attestations around that kind of thing, we might enable a higher, more economical rate for that kind of thing. I'd be happy to speak to you more about it.
I'll certainly make that connection, or Jake may already have that actually. So so my basic question is around the privacy. When I'm talking to many people in the health tech and healthcare industry, privacy and the fact that things are siloed is one of the biggest problems. And it seems like you've solved that. So do you see that there will be more opportunities for these different groups to actually collaborate because of what you're building?
Definitely. I think there's a really close tie between compliance, privacy compliance, and interoperability. And the hesitation around interoperability has been really sort of threefold. The first is the legacy nature of the technology itself makes it really hard to connect things together. But technology barriers can be solved, and there's efforts to solving them. And for example, the efforts from the HL7 organization around FHIR is something that we're very, very excited about. It's something we've been excited about since the beginning of our company, because of it taking a software application first perspective towards connecting data sources in healthcare together. And then there's really interesting kind of disruptive companies. We're big fans of the guys at Particle Health. We know them pretty well, and I think they're doing some really neat things in interoperability. The second is a little bit of vendor politics, where, I don't want to be too political, but the HIS and EHR system vendors sort of approached this market and transformed it with kind of this message that said, we'll do everything. And so they weren't really built from day one to be open platforms like you might see as data warehouses in other industries. But that being said, I think they're coming around, right? And certainly, like Epic, for example, has done a lot of really great things for FHIR compliance and support recently. And they all have, app ecosystems. I think the stuff that Allscripts does in supporting an app ecosystem is really interesting. And then the last hesitation has been around privacy and security. But the whole intent of HIPAA really was to enable the individual patient to have ownership over their data. And I think we all now recognize how important that is, especially in this new kind of digital first world of healthcare. The personal health record is a controversial topic about whether that'll ever really come about. Certainly, I think the work that Apple is doing in this space is really interesting. And they were really the ones to do it. Like, I don't think that anybody could have been anybody else who could have executed the way they are now. But the whole idea that you can store health data on an iPhone securely and then use Fire to actually deliver it to a health system that you're visiting is, I think, really interesting. All of these things will allow this stuff to become more fluid. So what you're going to have is technology enablers that enable the building of interoperable systems to be more possible. That's one. The second is you're going to have better privacy and security management, hopefully through platforms like ours, that then drive trust in the system. Says, I know you're not managing privacy of my data manually. You've got a system that actually does it and monitors in real time. Okay, I'm more willing to allow that to happen. And finally, patient empowerment and ownership, which then forces the systems to talk to each other. Compliance, we feel, is the foundation and bedrock and prerequisite for interoperability, but interoperability is actually the goal.
All right, awesome. Well, I think you're really showing us that there will be a time where these things are more possible, where different systems will actually, you won't have to go into the doctor and say the same story like 10 times. Right. So yes. That would be wonderful. Now we are quickly coming down to our end time, but is there anybody else who would like to ask a question? Then I have one more. So is there anybody who would like to ask a question?
Jacqueline,
yes.
I have no idea how appropriate or inappropriate this is, but I'm really intrigued with what you have. And so I'm with the Alaska Association on Developmental Disability, so large and small providers. Large providers have this mostly worked out, but I'm really curious about really small assisted living homes that are starting and have to then comply with all this stuff. It seems, is this appropriate for a small, like mom and pop kind of shop, or is it much larger?
Yeah, that's a fantastic and very fair question. Like, compliance is important in every realm. Now, my specific area of focus is in compliance of digital data. And so think of like software that sits inside an app. However, that being said, one of the most interesting areas of technology innovation in healthcare is innovations happening not even necessarily in hospitals, but in things like long-term care homes and track. I mean, I struggle to remember the name, but I feel like we just signed a new company who's doing that exactly. Certainly my friends at Reposodic, that's a company I'm huge fans of. They're in that space as well, where they're helping ensure some of the problems they solve, for example, helping to ensure that health data from different sources in that patient's journey are made available to the long-term care home to deliver care in the right way, helping to ensure that that care data is available, often in this case, to families who may be making decisions on behalf of the patient, and then helping with seamless transition to other areas of care, whether it's back into the home or back into the healthcare system, et cetera. With our growing senior population, which is obviously a big deal also here in Canada, this stuff becomes a really, really important component of healthcare. And as I mentioned, the big driver for digital health is chronic conditions. And chronic conditions often lead to areas in healthcare like you're talking about. Are they appropriate? Absolutely. In fact, enabling community organizations and small service providers to operate more efficiently is actually one of the big motivations of digital health. Because up until this revolution of these startups, who are all I work with, like a lot of my customers are 3-person companies. The only digital health were in the big giant systems that only existed in urban hospitals. And now we've got an ecosystem of these larger things. So it isn't so much that what my company would do would be selling it to a care provider, but some of my customers would. And so, we have them all listed on our website, but if there's an introduction you'd like, I'm happy to make it for you. You can, send me a message, let me know what you're looking for. I might be able to make some referrals.
Thank you.
Awesome.
You're very welcome.
Balaji, well, that is the end of our time. The last question I have for you is the one that I've borrowed from 1 Million Cups, and that is, what can this community do for you? How can we promote what you're doing, Balaji?
Thank you, Jacqueline. That means a lot. The first thing I'd like to say is, again, maybe coming back to what I said at the beginning, for those of you working on healthcare innovation, either technologically, like Jake mentioned, he's building an app, or as a service provider, or thinking about, way healthcare can work better, or even as a patient advocate, the work you do has never been more important. It's a tough slog. Please do, especially for those who are entrepreneurs, I have this firm belief that entrepreneurship has a responsibility to solve the world's biggest problems. Like, we work really hard. I know I do. And I wouldn't do it if I didn't believe in the change we're trying to make for the world. So, keep at it. If you know of anybody who's building any kind of software product, whether on behalf of a small company or in behalf of a service provider, that's dealing in health data, I would love to talk to them, because I think we can help, and I can certainly learn more about from their feedback. That would be the biggest thing.
Awesome. Happy to do that for you. Well, thank you everyone for coming today. We'll see you again in 2 weeks. We have another interesting company, Patero Tree, actually doing digital health. So come back, Balaji, if you'd like to. We'd love to have you as part of our community. And just thanks, and everyone stay safe. It's lovely to have you here.
Thanks a lot.
Is it possible we could leave the call up for just a second for follow-up questions, unless people have to rush? Cool. I really had to refrain from getting too into it, because this is kind of my wheelhouse. And so I have lots of questions, and I could probably take your whole afternoon, but I do have a few that I think are interesting discussion points, at least. The first one is, so I started my digital development career at a company called Mastery, which is doing a lot of what you're doing for the healthcare industry for retail about 10 years ago. And so the space is not new to me, in a manner of speaking, although those on the call know healthcare is kind of new to me. But I think one of the things that really spurred growth among these small creators was the availability of free resources, free cloud resources, right? So like even Azure platform, there's a certain tier of free. So do you have a way to work with those folks, right? So that they can start those pre-rev, pre-seed companies can start and then migrate onto something, because at your lowest tier, you guys are definitely, you're a seeded or revenue your clients are seeded or they have revenue, right? So do you have a way to work with those upstarts, the hackathon type companies?
Sure. Yeah, no, it's a great question, Jake. There's two parts of the answer to that. The first is we actually technically don't, and I'll tell you why. Again, this is kind of getting into the weeds a little bit, but the way MedStack works is we receive through the software interface the requirements for what you need to deploy into the back end, and then our platform deploys it in a single tenant virtual private cloud. But it's actually doing it on our account, and the reason for that is at the account level is where we can control all the privacy and security elements. But as a result, if you have credits from Azure, they're not recognized because Azure just sees it as MedStack traffic. Now, I will say that it's something we're working on and something we're looking at for a roadmap. But the more important way to think about this is that compliance, like we've seen companies at scale spend $1 million a year on compliance. Like it took $1 million to do high trust certification. Most people who have done it on their own have built a dedicated team to do it. So you're literally talking about 6 figures, even when you get started. So what a lot of our customers do is they'll leverage the credits for things like development servers and parts of their app that don't require access to the PHI. Maybe you're running UI or workflow or things like that. And then through IP whitelisting, they can connect it to the MedStack environment and we can operate this way. So that's kind of the approach we're taking now.
And do you offer all of the things like multi-tenancy and everything that you would normally get from that stack?
I mean, not everything, but most things. Yeah, right. So I'm happy to send you along some technical information so you can have a look in a demo, for example. But really, it's anything that can run in a Docker container, managed database, managed storage. The way you want to kind of orchestrate that, we have a single way in and out of the infrastructure through the load balancer that's configured in our system. But beyond that, you have the freedom to do, what it is that you need to do.
Cool. Hey, thanks a lot.
Yeah, no problem. Yeah, please send me a message, Jake. I think I posted my email address in there somewhere, and I'm happy to follow up with you.
Yeah, and I of course I think you do have one another's emails, but yeah. So Andrea and Margot, did you have any questions that you wanted to ask?
No, I didn't have any questions. This was just a super fascinating presentation. And I'm also appreciated hearing what Jake was saying, because I work at the university, and those I work with are typically students or very, very early startups who are much more in the ideation phase. So that was a super interesting question to hear as well. But I thank you for your presentation today.
Yeah, ditto. Just as an educator, very interested in what is out there in the ecosystem for healthcare startups. So awesome. Thank you very, very much.
Well, then with that, thank you everyone for coming today, and it's great to see you. And Balaji, we'll definitely be trying to connect some new ideas and tech startups to you. So thank you for.
That'd be great.
All right.
Thanks a lot, everyone. Please stay safe. Take care.
Thank you. Goodbye now.